This will be a bit of a change of pace, and I want to start by thanking Jane Orient for inviting me to give another talk at this meeting in Nebraska. My father was born and raised on a farm near the town of Cambridge in the southwestern part of the state, near McCook, and went to medical school at the University of Nebraska in class of 1938. He died of a stroke at the age of 97. But heart disease remains the leading cause of death in this country, which ends people's lives at a much younger age, closely followed by cancer. Heart disease causes 40% of all U.S. deaths. The prevalence of heart disease has not dropped with cholesterol-lowering statin drugs. Half the male population, over 75 in this country, has heart disease. There are two types of heart disease: atherosclerotic coronary artery disease, where cholesterol-laden plaques accumulate and build up and block blood flow through the coronary arteries, and heart failure, which is due to coronary disease in 70% of the cases. Heart valvular disease and alcoholism are other important causes of heart failure. While the prevalence of heart disease has remained fairly stable, hospitalization rates for congestive heart failure continually and steadily increase. Doctors prescribe some 80 different prescription heart medications that fall into 10 categories. Statins are by far the most commonly prescribed ones. The first statin, lovastatin, Mevacor, is a naturally occurring molecule that a fungus makes. Close to 3% of this oyster mushroom shown here is pure lovastatin. Other statins are synthetic variations of this fungal produced molecule. Statin use continues to grow. In previous decade, nearly half of everyone over the age of 65 took statins. 43 million Americans now take them. And new Heart Association guidelines recommend putting an additional 10 million Americans without heart disease on them. Some health authorities say that 97% of Americans aged 66 to 75, including all men in this age group, should take statins. This is a multi-billion-dollar business. Lipitor went on sale in 1977 and became the best-selling drug in the history of prescription pharmaceuticals. Sales surpassed $125 billion during the life of its patent. Crestor, now the top-selling statin, generated $5.2 billion revenue in 2013. These drugs are very effective in lowering cholesterol. Lipitor at 40 to 80 milligrams and Crestor 20 to 40 milligrams can drop LDL cholesterol levels by greater than 50%. Statins follow the politically correct diet cholesterol theory of heart disease, also known as the lipid hypothesis. It says that eating, quote, artery-clogging saturated fats raise serum cholesterol, and high cholesterol causes obstructive plaques to form in coronary arteries through a pathologic process known as atherosclerosis. In an advertisement, Pfizer proclaims that Lipitor reduces risk of heart attack by 36%, based on the findings of a large randomized trial where subjects took either Lipitor or a placebo. The trial showed that 2%, actually 1.9%, of people taking Lipitor suffered a heart attack, while 3% in the placebo group had one. considered in terms of relative risk reduction, the percentage Pfizer cites in the ad is correct. You calculate it by subtracting 1.9 from 3 and dividing the difference of 1.1 by 3, which equals 36%. Most trials, like this one, typically show a 20 to 40% reduction in relative risk. But the company was eventually forced to come clean and disclose the real risk. So now the ad also states in small print the 36% means in a large clinical study, 3% of patients taking a sugar pill or placebo had a heart attack compared with 2%. What the ad should say is that Lipitor reduces the risk of heart attack by 1%. That means that 100 people need to be treated for one person to benefit. So basically the ad states that statins are not effective in 99% of people who take them. The government and the pharmaceutical industry fund multi-million-dollar drug trials expecting correct results. Statin trial researchers satisfy them by employing a relative risk of statistical deception to make it appear that statins are effective. Statins inactivate the enzyme HMG coenzyme A reductase, which cells use to synthesize mevalonate, shutting down the mevalonate pathway and blocking the synthesis of cholesterol. This pathway also produces heme A, dolicol, and coenzyme Q10, CoQ10, also known as ubiquinol. CoQ10 is particularly important because it functions both as an antioxidant and with heme A in the mitochondrial electron transport chain produces adenosine triphosphate, ATP, the fuel that powers all living things. Dolicol is required for the synthesis of glycoproteins. The brain is 50% cholesterol. Although the brain only makes up 2% of body weight, it contains 25% of all the body's cholesterol. Cell membranes are 50% cholesterol. It is a key component in forming nerve cell connections, synapses, needed for good mental functioning, learning, and memory. Bile salts, vitamin D, cortisone, and all the sex hormones are made by cholesterol. Cholesterol also functions as an antioxidant, and it combats inflammation. Cholesterol is the body's natural healing substance. Blaming cholesterol for atherosclerosis is like blaming the police for the murder and theft in a high crime area. You may be surprised to know that more than 100 scientific studies document that cholesterol and saturated fat prevent heart disease, which investigator David Evans has compiled. In a second book, he presents evidence from another 101 scientific studies which show that low cholesterol leads to an early death. People who have what current-day health authorities consider high cholesterol actually live longer. This book shows in chilling detail how statins harm people. The reviewer of the book writes, and I'll read it, "Statins may be the perfect and most insidious human toxin that the adverse effects are often delayed by years and come about gradually. Further, statins frequently impair mental function to such a degree that by the time patients are in real trouble, they may lack the mental faculties to recognize the cause." This reviewer adds, quote, "Many practicing physicians have a healthy understanding of the current level of corruption and collusion among big pharmaceutical companies, governmental agencies such as the NIH and the FDA, and major medical associations such as American Heart Association. But the reader of this book will come away with the disturbing conclusion that it is even worse than imagined. Statins target skeletal muscle and brain cells in particular. Myopathy, manifested by muscle aches and pains, weakness and instability, is much more common than is reported in the trials. And the worst complication is rhabdomyolysis, where the muscle cells break apart and get in the renal tubules and cause kidney failure, resulting in a 10% mortality rate. A number of trials report a statistically significant increased incidence of cancer, cataracts, hepatitis, and strokes associated with taking statins. Approximately 8% of people who take statins get diabetes, compared with 2% in the placebo group. Investigators will say that there's a 6% chance of getting diabetes taking statins. They report deleterious effects in terms of real absolute risk, minimizing their magnitude. You do not see them saying that there is a 75% increased relative risk of getting diabetes, which is 6 divided by 8, taking statins. The FDA issued new safety information on statins in 2014, saying, quote, a small increased risk of raised blood sugar levels and the development of type 2 diabetes have been reported with the use of statins. The FDA now requires drug companies to add this information in their package insert with the drug. After this, over the next 6 months, attorneys filed more than 1,000 lawsuits for women claiming that Lipitor gave them diabetes. Adverse cognitive reactions from taking statins include confusion, forgetfulness, disorientation, memory impairment, transient global amnesia, and dementia. And to make matters even worse, statins may actually cause heart disease. Unfortunately, this study shows that statins may actually promote atherosclerosis and heart failure. Arterial calcification fosters atherosclerosis, but a special protein called matrix GLA protein removes calcium in arteries. Vitamin D turns on the gene that makes matrix GLA protein, and vitamin K2 is required to activate it. But statins block the conversion from vitamin K1 to K2. With statins also blocking coenzyme Q10 and heme A synthesis, generation of ATP in heart muscle cells decreases, leading to heart failure. This study, published last year an expert review of clinical pharmacology, citing 56 scientific references, shows how statins stimulate atherosclerosis and heart failure. I worked with cardiologists for 40 years as one of their heart surgeons. And given so much damning evidence against statins, why do they continue to prescribe them? Two reasons come to mind. First, cardiologists are busy and don't have the time to investigate things and read a lot of medical journals. They accept what their medical societies say and what the drug reps tell them about statins. And not wanting to be accused of practicing what health authorities deem to be low-quality medicine, they prescribe statins according to government-approved cholesterol-lowering guidelines. Second, like many professionals, mainstream cardiologists suffer from a healthy dose of confirmation bias, where they filter out and ignore evidence that doesn't coincide with their preconceived notions and beliefs, especially with regard to statins. As Fred Singer, Tony Heller, and Patrick Frank have shown here with regard to climate science. Medical science today also is in a sorry state. Dr. Marcia Angel, former editor-in-chief of New England Journal, writes this, I'll just read it. It is simply no longer possible to believe much of the clinical research that is published or to rely on the judgment of trusted physicians or authoritative medical guidelines. I take no pleasure in this conclusion, which I had reached slowly and reluctantly over my 2 decades as an editor of the New England Journal of Medicine. Dr. Richard Horton of The Lancet writes, the case against science is straightforward. Much of the scientific literature, perhaps half, may simply be untrue. Afflicted by studies with small sample sizes, tiny effects, invalid exploratory analyses, and flagrant conflicts of interest, together with an obsession for pursuing fashionable trends of dubious importance, science has taken a turn toward darkness. To make matters even worse, the FDA has approved an injectable cholesterol-lowering drug that you inject twice a month at $583 a shot, which comes to $14,000 a year. Working by a different mechanism, these PCSK9 inhibitors lower LDL cholesterol even more than the most potent statin. Amgen makes one called Repatha. Trials gaining FDA approval for the safety and efficacy of this injectable drug only lasted 12 to 52 weeks. Much too short a time to uncover late developing ill effects like infusion, forgetfulness, disorientation, memory impairment, and dementia, things that these inhibitors might well cause by severely lowering cholesterol. If not cholesterol, what causes atherosclerosis? The late Russell Ross, professor of pathology at the University of Washington, discovered the cause. Atherosclerosis is an inflammatory disease. It is initiated by endothelial dysfunction, with or without arterial injury. Macrophages and T lymphocytes mediate it, and smooth muscle cells play an integral role. Russell demonstrated that atherosclerosis is a chronic inflammatory and fibroproliferative process that is fundamentally not different from that seen in cirrhosis, rheumatoid arthritis, and chronic pancreatitis. I knew Dr. Ross and attended cardiology conferences with him. The New England Journal published his landmark paper on atherosclerosis being an inflammatory disease a few months before he died from cancer. Inflammation plays an important role in other chronic diseases like diabetes, cancer, and Alzheimer's disease. Nuclear factor kappa B, NF-kappa B, a key protein transcription factor, promotes inflammation. Statins' 1% benefit come from their anti-inflammatory effects, which suppress NF-kappa B. 2 non-prescription nutraceuticals, however, curcumin and resveratrol, do the same thing without any side effects. Things that foster inflammatory atherosclerotic heart disease are listed here, and they begin with a bad diet, which means consuming too many omega-6 vegetable oils, too many carbohydrates, not enough saturated fats, and eating trans fats. And then the deficiencies in various vitamins, mineral deficiencies, lipid oxidation products, and diabetes, abdominal obesity, hypertension, smoking, stress, and a family history. And it's becoming evident that the bacteria Helicobacter pylori, famous in the stomach, can also cause coronary artery disease. From my research on the subject, these are 14 supplements that may well help prevent and combat heart disease, along with a multivitamin pill. They are curcumin, the curry spice that comes from turmeric root, the bioflavonoid quercetin and resveratrol in red and purple grapes, blueberries, cranberries, peanuts, and pistachios, vitamin D, vitamin K2 as minoquinone 7, vitamin E in all of its forms, coenzyme Q10, alpha-lipoic acid, in its more powerful R-lipoic acid form. Vitamin C, especially in the new lycospheric, well-absorbed packets. Magnesium, selenium, zinc, ginkgo biloba from the 200 million-year-old maidenhair tree, and omega-3 fatty acids. I provide short descriptions of each of them in one of your handouts, their respective mechanisms of actions, where I get them and their costs. The cost of taking these supplements is not much different than taking a 20 milligram Crestor tablet every day. The mechanisms of action for these nutritional supplements fall into various categories. 10 exert an anti-inflammatory effect, which downregulates NF-kappa B, among other things, and blocks synthesis of inflammatory leukotrienes, prostaglandins, and thromboxanes. And as mentioned, vitamin D and K2 are critical for producing and activating the protein that extracts calcium from the coronary arteries. Ginkgo biloba, like aspirin, thins the blood and decreases platelet adhesiveness, but without the adverse side effects that aspirin has. And then there are also 4 absorbable network antioxidants. A large-scale randomized trial of people taking these supplements compared with the group on statin and aspirin and a control group on a placebo would greatly help document their value. But the federal government currently funds 51% of the 20,000 interventional trials that researchers are conducting. University foundations and other organizations sponsor 25%, and pharmaceutical companies 24%. Drug companies and the government will never fund a non-patentable study like this. There is evidence that a nutritional program like the one I propose can halt the progression of coronary atherosclerosis and reduce coronary calcification. This trial showed that taking nutritional supplements, many of which are what I recommend here, reduced coronary calcification on ultra-fast CT scans by 11% overall in the 55 patients studied. This scan shows in 4A the calcium in the right coronary artery and left anterior descending coronary artery, and then 1 year later, the calcium is pretty much resolved. Also, a nice study has been done on the effect of coenzyme Q10 on heart failure. And the study found that a higher percentage of patients taking 300 milligrams a day of CoQ10 remained free of major adverse cardiovascular events compared with patients on a placebo. And in graph B, there was an overall statistically higher survival rate from all causes than taking the placebo. And the nice thing about coenzyme Q10 is that you can take up to 10 times the normal dose without any side effects. A physician in Seattle, Dr. Brad Weeks, a fellow Dartmouth alumnus, introduced me to cold-pressed liquefied seed oil supplements. They taste like pomegranate juice. The 2-ounce, 35-calorie Rain Soul packet contains the content of black cumin, Chardonnay grape, and black raspberry seeds. And the 1-ounce, 15-calorie Rain Core has the 10 seeds shown here. They contain phospholipids, vitamins, and minerals, are rich in essential omega-6 linoleic and omega-3 linolenic acid, high in natural antioxidants, and contain various anti-inflammatory agents. And an extract from the black cumin seed, thymoquinone, has been shown to kill colorectal, prostate, and cancer cells. Studies show that there are 24-fold more nutrients concentrated in the seed than the rest of the plant. And 1 packet of the Soul contains the equivalent of 8 to 10 servings of fruit and vegetables and 2 to 3 servings of healthy oils. Given their anti-inflammatory and antioxidant aspects, drinking liquefied seeds may well turn out to be a good way to help prevent and combat heart disease. And people with different kinds of chronic pain also report surprising relief after drinking these cold-pressed seeds and applying them topically, including my wife, Linda. We have been taking 2 packets each of these Soul and Core every day now for 6 months. The pain in her hands and knees from osteoarthritis is much reduced. And for me, I turn age 76 next month, but I feel like I'm 56. And topically applying the Soul oil cleared up a long-standing disorder my wife had on her forearm, which had been bothering her. After several weeks of rubbing the liquefied seeds on it, this inflammatory lesion completely resolved and is not returned. Linda and I have become so impressed with these liquefied seeds that we have signed on with the company, Rain International, that makes them as seed nutrition affiliates. I don't know if they can prevent heart disease, but it sure does look like it's good for one's health. And for anyone who might be interested in them, visit our website, wellnesswithseeds.com, or talk to Linda or me at this number. Next are stem cells. These kinds of cells are distinguished by the fact that they can replicate themselves and are undifferentiated, thus capable of giving rise to various specialized cells. They can morph into many different kinds of cell types, including heart muscle cells, cardiomyocytes. The response to the death of muscle in a heart can take 2 paths: regeneration and restoration of function, or fibrosis and contractile dysfunction. In humans following a heart attack, a myocardial infarction that kills heart muscle, the dead muscle is replaced with scar tissue, with resulting contractile dysfunction. But remarkably, the hearts in neonatal mice less than a week old, newts, and adult zebrafish respond to heart injury and cell death by regenerating new muscle and accompanying blood vessels. A zebrafish can have 20% of its heart wrecked and still completely restore it to normal function. So why can't our hearts be made to function like the one zebrafish have and regenerate itself? It has been commonly assumed until fairly recently that heart muscle cells are post-mitotic, meaning they don't divide and have to function all through the entire lifespan of an individual without being replaced by any new ones. We can thank atmospheric nuclear tests for initially providing a means to refute this view. Before 1955, when atmospheric nuclear bomb tests began, the isotope carbon-14, with a half-life of 5,730 years, existed in the atmosphere in a low and stable concentration. It combines with oxygen to form carbon dioxide, which plants consume and then humans eat, along with eating animals that eat plants. It's like how Woody Allen views nature. It is an enormous restaurant where everybody eats each other. This particular isotope of carbon gets incorporated in our cells. The concentration of carbon-14 in the atmosphere rose substantially and peaked in 1963 when the Nuclear Test Ban Treaty was adopted, and then dropped back towards its baseline levels, as this graph shows. In people born before 1955, measurement of carbon-14 concentrations in their cardiomyocyte DNA and in proteins specific to these cells, troponins, have shown that some of their heart muscle cells were formed after they were born and are relatively new. Cardiomyocyte turnover does occur in humans, replacing the ones people were born with when atmospheric carbon-14 concentrations were much lower, with new cardiomyocytes containing higher levels of carbon-14. So muscle cells in the human heart, like in zebrafish, do in fact renew and replace themselves to some degree with new muscle cells. Investigators who first discovered this using carbon-14 as a marker calculated that humans renew their cardiomyocytes at the rate of approximately 1% per year at age 25, dropping as one gets older. By age 50, they calculate approximately 45% of a person's heart muscle cells have been replaced with new ones. Another group, more recently, however, employing a different technique, have concluded that annual turnover of human cardiomyocytes is much higher, especially in women, and that myocyte regeneration increases with age, as shown in this graph. These investigators calculate that all the heart muscle cells present at birth completely turn over by the time one becomes a young adult, have completely turned over once again in a middle-aged person, and have completely turned over yet again in the senescent heart. There are 4 types of stem cells. Embryonic stem cells are extracted from an in vitro fertilized human embryo that has reached the 5-day-old 200 to 300 cell blastocyst stage, which is 0.1 to 2 millimeters in diameter. These cells have the capacity to differentiate into all 3 germ layers, endoderm, mesoderm, and exoderm. Although best, ethical concerns have prevented using human embryonic stem cells as a treatment modality in patients. The heart has a pool of its own resident tissue-specific adult cardiac stem cells that congregate in niches in the apex of the left ventricle and atria and can turn themselves into new cardiomyocytes, vascular smooth muscle, and endothelial cells. About 1 in 1,000 cells in the bone marrow are mesenchymal stem cells, multipotent stromal cells that can differentiate into a variety of different cell types and can be reprogrammed in the laboratory to differentiate in the heart muscle cells. And then there are induced pluripotent stem cells. These are cells, in particular skin fibroblasts, readily obtained from a skin biopsy, that laboratory technicians genetically reprogram and engineer to behave like an embryonic stem cell and become cardiomyocytes. The journal Nature, however, in its weekly section titled News in Focus, reports doubts arising with regard to heart stem cell therapy. Referring to a study in the British Medical Journal, researchers found many discrepancies in the 49 supposedly randomized trials studying the effect of bone marrow stem cells on improving heart function in people with heart failure. These trials measured the heart's ejection fraction, the percent of blood the left ventricle pumps out with each beat, normally 66%. Apropos of what Doctors Angel and Horton say about the state of medical science, 44 of these 49 trials were rife with discrepancies, defined as 2 or more reported facts that could not both be true, since they were logically or mathematically incompatible. Discrepancies occur with regard to the design of the study, its methods, baseline characteristics, compatibility of table and figures, reported results. Trials with 30 or more discrepancies reported the best results, showed an average improvement in ejection fraction of 7.7%. Only 5 of the 49 trials had no discrepancies, and these carefully done, honest ones showed a slight decrease in ejection fraction in people treated with stem cells. CIPIO, which stands for cardiac stem cell infusion in patients with ischemic cardiomyopathy, was the first randomized trial using adult cardiac stem cells. Investigators enrolled 33 people who had an average ejection fraction of 27%. Each person first underwent coronary artery bypass surgery, the operation I spent my career teaching and performing. The surgeon removes part of the right atrial appendage. Technicians extract the resident stem cells in the biopsy and grow them in test tubes for 4 months and expand their number to 1 million cells. In 20 patients, these person-specific autologous cultured cells are injected back into the heart through a catheter placed in the coronary artery, supplying the damaged muscle, with 13 patients left alone, serving as a control. A preliminary report looked promising. But officials at Harvard, one of the universities participating in the study, retracted it when faculty observers found what they termed, quote, scientific irregularities in the study, which to date remain undefined. The other recent trials listed here have delivered indifferent, disappointing results. In all stem cell trials so far, the vast majority of transmitted cells die within a week. These researchers at the University of Washington proposed 3 ways to carry out cell therapy for heart failure. Cardiac-derived cells are obtained percutaneously from the septal wall of a person's heart and then grown in the laboratory and delivered percutaneously back through a catheter in the coronary artery or in the cardial side of the heart, or using mesenchymal stem cells in the same manner, or human-induced pluripotent stem cells from skin biopsy obtained fibroblasts undergo in vitro expansion and are engineered to be new heart muscle cells. For stem cells to successfully replace injured or dead heart muscle, they have to do a lot of things, in addition to just becoming new cardiomyocytes. They have to differentiate in the vascular smooth muscle cells and endothelial cells, promote neovascularization, remodel the extracellular matrix, inhibit apoptosis, cell death, provide paracrine signaling, localize hormone-like chemical signals to adjacent cells, and establish appropriate electrical connections to synchronously contract with other heart muscle cells. Plus, they must be able to repair adverse cardiac remodeling and reduce hypertrophy. Work on stem cells has a way to go before they will be ready for clinical use. Ideally, they will be such that you can get them off the shelf and not require a biopsy and have to wait for one's own cells to be appropriately processed before they can be used. Already processed pluripotent stem cells taken from other people, allogenic ones which work well and have no immunologic or other side effects, would fit the bill. Heart repair with stem cells holds an enormous promise, but it'll probably be another 10 years before they are off the shelf and ready to go, which still should be in time for all the people who will develop heart failure taking statins. When ready, you can go to a day clinic staffed with a cardiologist who will insert a catheter in your wrist, thread it up into your heart, inject off-the-shelf pluripotent stem cells, either in your coronary arteries or directly to the endocardial aspect of the damaged muscle. What about hyperbaric oxygen treatment? Veterinarians use them. A typical HbO2 treatment for humans or pets, is to breathe 100% oxygen at 1.5 to 3 times atmospheric pressure for up to 1 to 2 hours. Hyperbaric oxygen therapy is either gas-based or wound-related for the conditions listed here, but not as things presently stand for cardiovascular problems. Doctors that run this multi-person unit in Vancouver, BC, are testing to see if it works for strokes. They are enrolling 140 people who've had a stroke in the last 6 to 36 months, and we'll have them undergo 40 treatments to see if it improves their cognitive skills and depression. And now for $20,000, you can have your own portable hyperbaric oxygen chamber. And in fact, more than 150 NFL active and retired players, including Brent Favre, Donovan McNabb, Michael Vick, and a number of Seattle Seahawks players, each have their own portable hyperbaric oxygen chamber. The ball carrier being tackled here, New York Giants running back Rashad Jennings, says he spends 7 to 20 hours a week in his. Studies to date using hyperbaric oxygen therapy for treating unstable angina and heart attacks, acute coronary syndrome, show no significant benefit. There is some evidence, however, that HbO2 therapy improves heart function in diabetic patients. There are two kinds of heart failure. Systolic, where a weakened muscle can't squeeze well, and stem cells hold promise for treating this kind. 30% of people have diastolic heart failure, where the stiff heart muscle can't relax properly. So less blood gets in the ventricle to be pumped out. In the study shown here, 30 diabetics with diastolic heart failure underwent 10 hyperbaric oxygen treatments over a 2-week period. And after the treatments, tests showed that their heart failure, or their heart muscle could relax better, and the ventricle fill up with more blood, thereby improving cardiac output. It is well understood how HBO treatment works for gas-based conditions, but not wound-related treatments. A study published in the journal Undersea and Hyperbaric Medicine, done by my colleague and friend Dr. Jerry Pollack, professor of bioengineering at the University of Washington, shows what hyperbaric oxygen does to water. Studies in his lab document that hyperbaric pressure and oxygen each alone builds up a fourth phase of water, known as interfacial exclusion zone, EZ water. It is a semi-liquid, gel-like structured form of water that coats proteins in cells, enabling them to fold and function properly. Each EZ water molecule, H3O2, has 2 oxygens, unlike bulk water, H2O with 1. And it stores energy, the only phase of water that, with its negative charge, stores energy that drives chemical reactions, capillary blood flow, and cellular work. A high concentration of oxygen in the blood expands this fourth phase, as does hyperbaric pressure alone. Like with ice, exclusion zone water, with its stacked, honeycombed hexagonal structure, remains in place and is slow to dissipate. Hyperbaric oxygen effect on expanding the fourth phase of water may best explain how this short-lived treatment can exert a persistent and lasting beneficial effect on wound healing. There are 12 Nobel laureates at the University of Washington, and I predict that Dr. Jerry Pollack will be the next one to be awarded a Nobel Prize at this university for this discovery relating to water. Oxygen all by itself, leaving atmospheric pressure unchanged, expands EZ water. This company, Live Oak 2, makes a generator that concentrates oxygen by filtering out and removing nitrogen from the air. The processed high oxygen is stored in a reservoir, this large bag, from which one breathes. Like with stem cells, over the next 10 years, a lot more will be learned about breathing increased concentrations of oxygen with or without hyperbaric pressure to improve health in various conditions. In closing, before I head back home to Leavenworth, Washington, refuse to take statins. Consider taking nutritional supplements to help prevent, or if already the case, to combat heart disease. And stem cells, hyperbaric oxygen, and oxygen treatment alone lie in the wings awaiting further research. And for those of you who like to keep up with new, important scientific discoveries, read Dr. Pollack's book, The Fourth Phase of Water. Thank you.
I had about 10 years ago heart tests and stuff, and the doctor, I had low cholesterol, and the doctor said, gave a subscription to statins. And I said, how come my cholesterol's low? And her answer was, I have to do that. And then my other general practitioner said, yes, the guidelines they're obliged to prescribe them, even with low cholesterol. And then secondly, on leaky heart valves, is there anything relevant with what you're saying?
With regard to the first question, the doctors now are in a difficult situation because if they don't give statins, they're accused of practicing low-quality care. And when I ran the heart program at the VA hospital the last 10 years of my career, one of the quality metrics was giving statins to the patients after their surgery. And I would have to go by and sort of speak in their ear and tell them to take a low dose or just don't bother with that, give them the prescription. With regard to a leaky heart valve, there's no relationship that I'm aware of between cholesterol levels and heart valve function.
Well, I just want to say the next step, though, is mandates. You know, everything you said about statins is also true. I mean, Fosamax for bone health, vaccines now, and it's what they do. I mean, what they're doing. You didn't mention the mandate part of this whole thing, but what they're doing is they're telling doctors, if you don't do certain things, we're not going to pay you as much. And what used to be, and we told them this was going to happen, what used to be recommendations are now the guidelines, and that's what makes you practice outside the system. And the next thing is going to be mandates, and what they're, you know, I don't know about statins, but it just seems like that's what they're doing at the state and federal level. They're starting to squeeze us so that you can't opt out, you know, and that's really...
That's absolutely correct. And the next step after what you say is that it becomes a medical legal issue, and the lawyers will say, you didn't follow these guidelines, and therefore you committed malpractice.
As my boss would say, I'm N equal 1, but I think we're all aware the initial warnings when you get statins is it may cause muscle pain. Some people decide not to take it for that reason. That didn't last very long for me, so I did start taking them. I went to a neurologist because of a familial tremor or essential tremor condition, and he was testing my upper body strength, and he said, you don't have any. For a kid who looks pretty fit, you don't have he called me a kid. He was probably 10 years older than me. But he also, I inferred from his comments that this relationship to statins, loss of upper body strength was what he pointed out, was more prevalent in women based on the number of women he said he had recommended either greatly reducing or eliminating statins, and their upper body strength came back. With regard to a couple other symptoms you mentioned, I rode a motorcycle for about 10 years, and I started to notice that I had a couple close calls, and you know, think, well, that's life. You ride long enough, and the odds are going to beat you. Eventually, was involved in an accident. It was not my fault. Guy pulled right out in front of me. I hit him, but laying in the street, looking up at the sky, thinking I had a broken hip, I said, okay, God, I get it. And so I gave up my motorcycle, but I do believe that I've had some significant memory loss in the last 10 years or so. And so based on what you said, I'm strongly going to consider completely going off statins. I was taking 20 milligrams a day. Now I take 5 every other day.
Well, I would advise you strongly to stop taking them. And the big problem, as I quoted in one of these slides, is that the side effects sneak up on you. And by the time you've got a level of dementia to the point that you can't associate it with anything, and it was the statins that have been doing it by blocking the mevalonate pathway and all these critical chemicals that get blocked in addition to cholesterol.
Yes, I'm Brad Mosley from Albuquerque, New Mexico, and I want to thank you for the talk. I enjoyed it. I especially enjoyed your talk in Albuquerque, though, in 2010, where you exposed a lot of big fat lies, and that is on YouTube. I've watched it many times and referred a lot of patients to it, but I guess my only thing on this talk is that I wanted to say, as a family practitioner and working in a hospital that had bypass program and seeing so many patients and reviewing so many lipid profiles. The one thing I noticed is that the real issue, cholesterol-wise, with people that had gone through the bypass and actually had the surgery, almost all of them had super low HDLs. And I think the focus on cholesterol was wrong to go to the LDL. I don't worry about LDL that much, but I have noticed that the bypass patients almost all have very low HDLs, like below 29 or 28 even. I wondered if you had noted that at all. But I also, the only other comment I would have is that most of the studies on vitamin E supplements have not been so good, but I tell patients to get their vitamin E through eating nuts, and that nut oils have a lot of natural vitamin E in them, and those are very beneficial. There was a New England Journal article about eating nuts actually reduced heart disease. So I recommend that. I also wondered what you thought about the old HATS trial, knowing that you were on the West Coast. I don't know if you recall the HATS trial in Seattle, which was done on veterans, and it was an angiographic trial, but they actually showed reversal of coronary disease with niacin. And again, going back to the HDL, niacin is one of the few things, and again, it's not patentable, but it was one of the few things that actually raised HDL and reversed heart disease in the HATS trial, and I wondered if you were aware of that trial, but...
Yes, I am, and a cardiologist, Dr. Gordon Brown, was the head of that, and he got some flack because he was supposed to do the trial and show that niacin wasn't any good. And it turned out the other way, and he took some heat for it. I've not seen the HDL correlation with surgery. I've not noticed that. And with regard to the studies on vitamin E, you basically need to throw them all out, because the vitamin E they used was a synthetic one that just had one of the 8 components, and it wasn't the real natural vitamin E. And as I pointed out, you really need to take the tocopherols and tocotrienols, to take them all, and not just the vitamin E in some tablet.
That's great. Yeah, I had a lot of hope for niaspan when it came out, but it's kind of faded away too. But I had a lot of hope for niacin at one point because it did help all the parameters. But thank you.
Hi, Scott Replogle from Boulder, Colorado, and I'm a surgeon also. And I've seen a lot of quackery in my specialty, but one thing I just wanted to add to your list of bad medical practice, you mentioned confirmation bias and some other problems, and that is the tendency to treat a number. Very common problem. The number becomes the problem, and you do something that brings the number down, and you think you've done something positive.
Yes, that's a very important point. And the doctors with the guidelines they have to follow, I mean, the cholesterol guidelines are all numbers, and they don't take into consideration anything else. And unfortunately, our young doctors are being inculcated in this approach, and you know, we're losing the real doctors in the process. We all done. Okay, thank you.